Hey there, I'm Dr. Tingle. See, we have you in for a little cranial nerve exam today to address some of your ADHD sensory issues. Come on in and have a seat. Today's exam, we will be testing your sense of sight, your hearing, your sense of smell, taste, and touch. Since you do have ADHD, and I do as well, we are going to be taking this very slow and very gentle today. I will let you know exactly what I'm doing so you don't have to feel any anxiety. This exam will be completely painless and it should also be very relaxing for you, okay? Okay, so to begin the exam, we are going to do a very brief face and scalp exam on you. So I'm going to have to touch you a little bit. Is that all right? Okay. So if you feel any pain or discomfort or you need a little break at any point in time, you let me know. So I'm just going to come up here, just going to gently look around your scalp, in your hair, in your forehead area. And just looking for any lumps or bumps, anything that might look a little out of place, but don't worry. I'm not finding anything. Now, since we are going to be talking about your sensory issues today, is there anything in particular you want to address? Okay, some hearing sensitivity and some light sensitivity, okay. That's pretty common with people with ADHD. I have some hearing sensitivity myself. It's kind of annoying when you can hear electricity in the walls. It can drive you a little crazy, so I feel ya. So I'm just gonna keep looking at your face here. Just gonna look at your forehead and just a little palpation. Good. 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 And we're gonna just look at your temples real quick again. Little palpation. Good. Little palpation. Good. And both sides. Great. Now I'm going to look at your T-zone and then under your eyes. So I'm just going to end up palpating down your nose and then running my thumbs under your eyes, okay? Any issues with that? Alright, thank you. So we're just going to gently press down the nose. Press. Good. Press. Good. No problems. Now under the eye. And we're just going to just gently press and rub. Press and rub. Rub. Press and rub. Wonderful. Any discomfort? Great. Now I'm going to just gently touch your cheeks a little bit and then work my way under your jaw. Alright, so hold still. You can close your eyes if you'd like at any point in time. And as I said, if you ever need a break or you just need a moment, you let me know. I know that it can be very tough to sit still through one of these exams, but as I said, I have ADHD too, and I know how tough it can be to try to keep present and stay focused on one thing. So if you need to let your mind drift during this exam, that's completely fine. I only need your attention for a few things, so you don't have to worry about that. Like right now, if you want to drift, feel free. I'm just going to feel under your jaw. Feel under your jaw here. Just feeling your lymph nodes back here on your jaw. Just go ahead and give me a clench real quick with your jaw. Good. That feels a little tight. You clench your jaw at night, maybe. That happens with ADHD sometimes because there can be feelings of anxiety and worry that come with ADHD. Because hyperactivity does not necessarily mean physical hyperactivity. It It also can mean hyperactivity of the mind, which means ruminating thoughts that kind of run away from you, being sent down spirals of negativity, which can lead to anxiety and then feelings of depression and sadness. And that's kind of things we want to help you avoid and also help you learn how to cope with and deal with, because it sucks and we don't want you to feel like that. And we also don't want you to have to lay awake at night feeling like that and not getting any sleep, because especially for ADHD people, sleep is very, very important. Alright, well, your face looks great. We will come back to that a little later during this sensation portion where we're testing your sense of touch, but we're going to start with the easy portion of the exam first, which is your sense of smell. Now, I know some scents for people with ADHD can be very triggering. I myself, and I know this is going to sound very weird, but Parmesan cheese and basil. So when people make pesto, I don't know why, but the smell makes me, oh, it's so bad. I actually have to leave the room. So if there's any sense like that will make you feel kind of icky, you let me know and we'll avoid that for this portion of the test. Alright, good. We're going to stick with some very basic ones, alright? Okay, so I just have a little bottle here, and I'm just going to ask you to close your eyes for me, and you are just going to take a little sniff, a little smell, and what do you smell? Vanilla, very good. Very good. We're going to do one more. Alright, so close your eyes again for me, and take a very little quick sniff, and we have some lavender. Very good, very good. Alright, well, seems like your sense of smell is perfectly intact, and it doesn't seem to be hypersensitive, which is great, because sometimes hypersensitivity can be very, very tough to deal with. So we're going to move on to your sense of taste now. This is going to be very quick, very simple, but like with the sense of smell test, are there any flavors that are triggering for you? Alright, so we're going to keep this again very simple as what I like to call the toothpaste flavors, since most folks are fairly okay with those. So we're going to do 2 again, and you can close those eyes and just stick out your tongue. And I'm just going to drop a little drop of this on your tongue. 1, 2, 3, and drop. And what do you taste? Peppermint, very good. Alright, and we're going to do that one more time. So close those eyes, and you let me know what you taste. Chocolate, very good. Okay, go ahead and open your eyes now. So, the sense of taste is intact, sense of smell is intact, and now we're going to look at your eyes. So, a lot of people with ADHD can have sensitivity to light, sensitivity to sound, sensitivity to touch, or all 3, or any combination of them. Now, do you have any of those that you'd like to let me know? A little light sensitive. I remember you mentioned that earlier. Alright, so I'm going to show you 2 lights. I have 2 different pen lights here. One of them, as you can see, it's pretty bright. The other one is a little bit softer. Which one would you like me to use for the exam today? Soft one? Okay. As I said, fairly soft. So, to begin your eye exam, I just want you to look at me. I'm going to just step back for a sec. I'm going to hold this light up, and I'm just going to pass it over your eyes. Just looking for anything abnormal that sticks out. Okay, good. Good job. I know your eyes might get a little heavy during this. Personally, watching a light slowly go back and forth can be a very relaxing thing to watch. But I'm just looking for how your eyes react for now. Good. Now I'm going to do a little test on your pupils. So I'm going to use this ocular occluder, just like this on your eye. And then I'm going to take this light and I'm going to swing it in and then out so that I can see how your pupil dilates and contracts, okay? Now, you let me know if you need a break after each eye or if you're good to continue, okay? Now this is going to seem a little bright, so just bear with me. In and out, good. In and out, good. In and out, good. In and out, good. Doing okay? Alright. And let's do the same thing on the other side here. And in, out, good. In, out, good. In, out, good. Wonderful. You're doing a great job so far. Do your eyes need a little break? Make sure you blink a little bit for me. We don't want them getting dried out. And that's definitely something that happens to people with ADHD. Have you ever fallen into a little bit of a hyper-focus mode with your ADHD? Found something that you just were really into and you sat down or you were doing it and the next thing you know, you looked at the clock and it was like 10 hours later or 6 hours later. Yeah, and sometimes you don't blink. So hyperfocus can definitely be something that can be great with ADHD, get a lot of stuff done in a really compact amount of time. But it also can be something that can be a little detrimental. You forget to eat, forget to drink, and forget to blink. And we want to make sure that we're keeping you healthy. So we're going to continue with the eye exam now. I just want you to look at my finger here. And don't follow the light. Just look at the finger. Good. Good job. Good. And same thing. Don't look at the light. Just follow the finger. Follow the finger. Good. 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 You are doing such a good job. Alright, so now I would like you to just close one eye for me if you can. And just follow this light. Good. Is it a little too bright? Okay. I'm just going to back it up a little bit. There we go. Good. Just follow that light with one eye. Good. Good. Alright, other eye now. Just cover that. And follow. Good. Good. You're doing such a good job. There we go. Good. Alright, so let's give your eyes a little break from the light for a minute. And let's just do a little quick Snellen chart here. I'm sure you've seen these before, right? Alright, so we're just going to read down, top down. You read the letter I point to, okay? Good. 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 And this one. Great. And this one. Good. How about that? Wonderful. This one all the way down here. Great. You're doing great. You ready for the light again? Okay, good. So now I would like to take a look inside your eye, if you don't mind. So for that, I'm going to use my ophthalmoscope here. So you can see a little light, and I'm going to have to get kind of close to you. Is that all right? All right, so what I'm going to do is I'm going to get up really close, and I'm going to use this to look inside your eye, so I can take a look at your ocular nerve, okay? All right, so just bear with me. I'm just going to open up your eye real quick and just take a look inside. Good, good, good. Would you mind looking up for me? Thank you. And now down, please. Thank you. To your left, please. Good. And to your right, please. Good. Wonderful. Take a look in the other eye now. So same thing, gonna come up real close, real close, real close. And looking straight ahead, please. Good. And look to your left, please. Good. And to your right, please. Good. And up, please. And down, please. Wonderful. All right. So everything looks good on the ocular nerve there. I would like to run a few more quick eye tests with you, if you don't mind. Just to make sure that everything is working as it should. So I'm going to use a little bit of a different light now. This light actually goes on my finger like this. See? So I can go like that and then that. So what I'd like you to do is I want you to pay attention to my finger and you let me know when you can see the light and when the light goes away, okay? Alright, you ready? Here we go. Good. Good. Good job. Good. 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 Now, both eyes, I want you to follow the light. And I want you to don't pay attention to my fingers over here. They aren't important. Good. You have great focus. You are doing a great job. And I think your eyes are absolutely perfect. I would like to do one more eye test with you, which is just a little color blindness exam with Ishihara plates. So I'm sure you've seen these before. See, look. Just like this. Yeah, you've seen these before. Alright, so we're going to start with this plate right here. Good. And how about that? Good. How about that one? Good. And this one. Very good. do one more here. That one. Good. That one. Very good. Alright. So, no color blindness detected, which is fantastic. Do you want to do a little peripheral vision test with you? So this test is very simple. You're going to look right at me and you're going to let me know when my fingers come into view like that and when you can no longer see them, okay? Alright, so look straight at me. Good job. And here we go. Good. Good. And again, good. Good. And boom, very good. Simple. And you did fantastic. So now we are going to move on to testing your hearing. Alright. Now before we begin this portion of the exam, do you have any hearing sensitivities that I should know about? A little sensitive to sound, okay. Are there certain sounds that get you kind of feeling a little bit triggered or a little bit just uneasy? High-pitched noise, okay, so we're not going to use the tuning fork today. I can definitely empathize with that. Anything else? Alright, so to begin this portion of the exam, we're going to start with a basic, just outer examination of your ear. If you'd like, you can close your eyes, relax. I'm not going to need you for too much during this portion of the exam. Just going to come over here and just gently inspect your ear. Just look around the outside, making sure I'm not finding anything out of place, but everything looks good so far. Look at that. Looks perfectly healthy. Okay. Alright. I'm gonna check your other ear now, alright? So same thing, just gonna inspect the ear here. Okay. Alright, everything looks good. Alright, well, those ears of yours look great. Now I'm going to take my otoscope here with the little light and I'm going to just take a look inside of each one of your ears, okay? Alright, so you let me know if anything feels a little weird or if you need me to stop or take a break. But this should be very quick, very gentle. Just going to come over here, just lift the otoscope in very gently, and just looking inside your ear canal here. Looking for any signs of impacted earwax, any inflammation, any damage to the tympanic membrane, but everything is looking very nice, very clear. Okay, good. Alright, and we're going to come over here now, same thing in the other ear. Just gonna take a look. Alright, good. Everything looks clear over here. Tympanic membrane, nice and pearly. Alright, good. The inside of your ears look great. So we're going to do a few hearing tests on you now. The first one is just going to be some sound recognition. I'm going to ask you to close your eyes. I'm going to make a sound just like this in each ear, and I just want you to let me know which ear you hear it in. You can tell me, or you can just lift a hand or a finger, okay? Alright, so close those eyes for me. And here we go. Good. Very good. Great. Good. Alright, good. Keep those eyes closed for me. We're going to do the same thing, except this time we're going to do it with words, alright? Okay, so just close those eyes, and you let me know what word you hear. Relax. Good. Sleep. Good. Dream. Good. Peace. Good. Content. Good. Blissful. Great. All right. Open your eyes for me. I have to say that I think your hearing is perfectly intact. So we're going to move on to the final portion of the exam, which is going to be the sensation test. I'm also going to be looking at your muscles in your neck and your shoulders and taking a quick peek in your mouth. All right? All right, so why don't we start by taking a look inside your mouth? If you don't mind, don't be embarrassed. It's okay. Go ahead and say ah for me. Just gonna use the nice gentle light. Take a look inside. Okay. You brushing your teeth twice a day? I know it can be hard, and ADHD people actually tend to have a tendency to have issues with oral hygiene, and it's not because they don't want to have nice teeth. It's because sometimes it can be hard to remember little things, which is why with people with ADHD, having things out in the open where they can see things can help remember them, and also helping to build good, stable routines that you know that you can accomplish on a daily basis. It's about achievable goals, realistic expectations. Remember, ADHD does not make you less, does not mean you're broken. Okay? Because if you are, then I am. And if that's the case, well, we're in this together. And let me tell you, I've survived a long time with it. It's gonna be okay. Some days are harder than others, but we get through them. And if you ever need it, anything or any help, you can always come back to Dr. Tingle. So, your mouth, on the other hand, looks fine, but try to keep up with that brushing twice a day, okay? Or at least once a day. You really, really, really don't want to get cavities. They're bad. So we're going to take a look at your neck musculature. I'm just going to feel around your neck here. Okay. Just feel around your trachea. Good. Good. No lumps, no bumps, nothing out of place, which is great. Good. All right. Now I'm going to do a little muscular test on you. I'm going to have you shrug your shoulders up, and I'm going to try to press them down. You don't let me press them down. It's going to be a little game. Okay. Let's go ahead and shrug. And don't let me press them down. Good. One more time. Don't let me press them down. Good. Good, good, good. All right. Relax your shoulders. Relax, relax. We are going to do a little bit of a similar test on your face. I'm going to just gently place my hand on your face like this, and I'm going to try to push your head to the side. You're going to resist me, okay? All right, so here we go. And 1, 2, 3, push, resist, resist, resist. Good. And the other side, 1, 2, 3, push, resist, resist, resist. Good. And same thing again. 1, 2, 3, push, resist, resist, resist. Good. And same thing. 1, 2, 3, push, resist, resist, resist. Good. All right, so that's all looking fantastic, and we're gonna just do a couple facial tests just to make sure everything is good on that face of yours. And this is gonna be a little bit of a funny portion of the exam. So I want you to raise your eyebrows real high for me like this. Good. And now frown real big like this. Good. And now give me a big old smile. Good. And now puff your cheeks out like this. Good. And I'm going to try to pop them. Don't let me pop them. Pop, 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 pop. Good. One more time. Puff them, puff them, puff them. And don't let me. Good. 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 All right. So we are going to move on to the final test of this exam, which is the sensation test. So this is going to be utilizing different objects to touch you on different portions of your face and your neck, and you're going to identify those objects for me, okay? Have you any skin sensitivities that I should know about? So, no cotton balls, no cotton swabs. I can definitely empathize with that one. I don't really like the way cotton feels either. And when it comes to skin sensitivity, it's not just about how, that little thing feels. It can be even clothing. I know for myself, there's certain fabrics that make my skin feel kind of like itchy. I don't like having stuff on my neck. No rings, no watches, no necklaces for me. I just don't like the way that kind of stuff feels on my skin. And you know what? That's okay. You don't have to wear rings. You don't have to wear a watch. You have to do what feels best for you and how you can feel the most comfortable in your own skin. So, aside from the little cotton swabs, anything that you don't want to be touched with. All right, good. Okay, so for the first sensation test, we are going to use a brush and this very dull metal tool. So I'm going to just, if you don't mind, I'm just going to brush your face like this. That's going to be the soft. And then this is going to be the dull. Okay? Alright, so close your eyes. And you let me know what you feel. Soft, very good. Dull. Soft, good. Dull, good. Dull. Soft, good. Dull, good. Soft. Soft again. Dull, very good. Soft, very good. You can open your eyes now. Now we are going to do that again, except we're going to use a even softer brush and then a different dull object, okay? Alright, so close your eyes for me. And here we go. Dull, very good. Soft, good. Dull, good. Soft. Dull, good. Soft. Soft. Soft, very good. Okay, so I want to do one more sensation test on you. I have this little tube here with this little bulb on the end, and all it's going to do is spray out a little air. And I want you to just close your eyes, and you let me know if you can feel the little puff of air on your face, okay? Alright, so close your eyes, and good. Very good. Great. Alright, go ahead and open those eyes for me. Well, you have passed this exam, my friend, with flying colors. And there's not anything wrong with you, though I can definitely see that you do have some sensory issues related to your ADHD, and that's perfectly okay. There's things that we can do to help you mitigate those issues and the situations you might find yourself in when it comes to light sensitivity, blue blocking sunglasses, sunglasses in general, polarized lenses, even hats. When it comes to your auditory sensitivity, headphones, noise canceling headphones, earplugs are your best friend. And when it comes to the smell, well, there are nose plugs and nose clips, but no one wants to walk around with those. And it can be a little difficult, but sometimes we just kind of have to tough it out, which I know no one likes to hear that, but it's true. But if you ever need help or you ever want someone to talk with about your ADHD, you can always come back to me and I will gladly listen. But for now, I'd like you to go home, take the rest of the night to just relax, get in some comfy clothes, put on your favorite comfort show, you know, the one you've watched about 15 times by now, and just cuddle up and enjoy the night and get a great night's sleep. And don't forget to hydrate, hydrate, hydrate. All right? All right. So, schedule your next appointment at the front desk on your way out, and we will see you again soon. Bye-bye. Hi there, I'm Dr. Tingle, and I see we have you in today for an EFT tapping therapy session. EFT is an emotional freedom technique that comprises tapping on the meridian points around your face to help you relax, calm yourself, overcome some anxiety and fear, and help you refocus and center your mind. When doing an EFT session, we identify a problem of fear or an anxiety. We then rate that problem on a scale of 1 to 10 and come up with a phrase to help us overcome it. So, for example, if today, because I have ADHD, and even though I have good routines and systems in place to help myself, that executive dysfunction does dysfunction. Sometimes you just have one of those days. So maybe I'll do a tapping and go, I know my executive dysfunction was off today, but I accept that, and tomorrow I will try and have a better outlook on the day. Just something simple, something positive, and something self-affirming. If you are using this kind of therapy to just help relax and de-stress, you don't even have to come up with a phrase or identify a problem. You can use the simple motions and repetitive technique to just relax and help stimulate parts of the body and calm that central nervous system, which can be extremely helpful for people with sensory issues, overstimulation problems, or ADHD. Alright, so I'm going to show you what the meridian points are that we will be tapping on today. Alright, so to begin, we start with the hand, and we start right here on the side. This is sometimes identified as the sore spot or the KC spot, right there. And then we go from a top-down position. Some folks start at the top of the head, but most will start at the eyebrow, then the side around the temple here of the eye, under the eye, under the nose, under the lip here, on the collarbone, under the armpit, and then to the top of the head. If you don't start at the top of the head, you can also add in the fingertips, if that's something that you like to incorporate. But again, when using this technique for simple stress relief or to just help kind of recenter or refocus your mind, or for myself, I like to use this when my brain is just not working and I can't recall some information. I will work through a tapping sequence, and that will usually help jog things free. So I'm going to start by just showing you how this is going to work on myself, and then we will begin the therapy session on you. When doing the tapping, we use 2 fingers to increase the surface area. And normally, you can do this 5 to 7 times in each spot. When you're doing this kind of exercise for overcoming an anxiety or fear, you want to repeat it twice. If you're doing this just to help calm and center yourself, just keep repeating it until you feel a little bit better. Alright, so I'm going to show you how we do this here. I prefer to start at the top of the head myself. So we're going to go to the top of the head, and as I said, 5 to 7 times. So it's 1, 2, 3, 4, 5, 6, 7. Just like that. And then we go to the eyebrow. 1, 2, 3, 4, 5, 6, 7. Side of the eye. 1, 2, 3, 4, 5, 6, 7. And then under the eye. 1, 2, 3, 4, 5, 6, 7. The lip. And the chin. To the armpit, or the collarbone, I should say. 6, 7. And the armpit. 1, 2, 3. And then when I'm just trying to think, I like to do the fingers, because if I'm just sitting at my desk and trying to think and contemplate something, I can just sit there and go 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. Simple as that, okay? So, are you ready to begin? Okay. So since we have you here tonight to help you relax and try to sleep, I want you to identify anything that you might want to get off your chest, overcome. You don't have to tell me at all. You can keep that to yourself if you like while I'm doing the tapping therapy on you. And as I said, while I'm tapping on you, you're going to repeat that phrase to yourself a few times over. 2 to 3 times, okay? Alright, so, are you ready? And if you like, you can close those eyes while we tap away. Alright, so we're going to start top of the head down, okay? Okay, so here we go. And 3, 4, 5, 6, 7. Good. Eyebrow. 4, 5, 6, 7. Side of the eye. 1, 2, 3, 4, 5, 6, 7. Under the eye. 1. Under the nose. 1, 2, 3, 4, 5, 6, 7. Under the chin. 1, 2, 3, 4, 5. Your collarbone. 4, 5, 6, 7. The armpit. 1, 2, 3, 4, 5, 6, 7. And now your fingers, starting with the pinky. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. Alright, so that's one cycle through the tapping. How'd that feel? It can take a little getting used to, but I think you will overall find this a very, very useful and helpful technique to help calm yourself, center your mind, and help ease and relax those thoughts. So, we're going to go for round 2. Alright, and I'm going to probably rotate different sides of your face, and we will also do one where we do it simultaneously. So again, you can close those eyes, and here we go. top of the head. 1, 2, 3, 4, 5, 6, 7. Good. And eyebrow. And 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. All right, you can go ahead and open your eyes now. How you doing? How you feeling? A little bit calmer, a little bit more relaxed. Just kind of finding a little bit of ease at the moment. Okay, good, good, good. And that's what we want to see. Okay, so I'm going to do another round on you. This time I'm going to do it on simultaneous points, okay? So again, we're going to start with the top of the head here. So just hold still for me. And 1, 2, 3, 4, 5, 6, 7. Good, good, good. 6, 7. 2, 3, 5, 6, 7. 5, 6, 7. To the fingers. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 5, 6, 7. Good. How are you feeling now? A little bit better. Okay. So why don't we take a few deep breaths, right? We're going to go in and then out. Good. In one more time. And then out again. Good, good, good. And in one more time. Then out again. Good job. Alright, so why don't we have you try it on yourself a little bit this time. You can follow along with me, and we're going to do 5 taps. So 1, 2, 3, 4, 5 on each meridian point, okay? Okay, so just follow along with me. Let's start at the top. And you ready? 1, 2, 3, 4, 5. Good. Eyebrow. 1, 2, 3, 4, 5. Side of the eye. 1, 2, 3, 4, 5. Good. Under the eye. 1, 2, 3, 4, 5. Under the chin here. And right here. Now, down to your collarbone here. Good. And your armpit. Good. Now your fingers. Good. 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 See, it's nice. It's easy to remember. You just go top, down, from the top, down, top, down, top, down. But as I said, if you are just doing this to relax or just trying to study or maybe just trying to concentrate, trying to recall some information, one of the things that I find helpful is what I like to call just doing the triangle here. So I'll do this. And I just get into a little rhythm. And then sometimes if I'm really having trouble, I will just sometimes you can just do it in one spot. if you want, sometimes I'll do this. It's really whatever makes you feel a little more relaxed. So why don't we try a little of the triangle of trifecta, I call it. So we'll just, ready, and there we go. Do another side here, and alright, so just relax a little bit. Let's do a little breathing again. We're just going to breathe into our nose and out through the mouth. Good. Into the nose and out through the mouth. In through the nose and out through the mouth. Good. Alright, and since we're trying to get you to relax so that you can get to sleep, I have found, along with doing the EFT tapping, that doing just individual finger tapping while I'm trying to sleep can help prevent my mind from wandering. Because ADHD people, the hyperactivity, it's not just physical, but it can also be a hyperactivity of the mind, which can be racing thoughts, running thoughts, going off on tangents, info dumping, spirals of anxiety, doom spirals, all those kinds of things can be associated with hyperactivity. So, giving your body physically something to do can help to distract the mind while letting you focus on what you are trying to do, which is one of the greatest things about the EFT tapping, is that it can help you refocus, center, relax, de-stress, and overall help ground you. So as I said, in bed I will do a little tapping, but I will also do a little bit of the fingers, especially if my legs are feeling restless, because sometimes you just get those muscle shivers at night and you want to kind of just squirm in bed, but you need to relax and sleep and keep that body still and keep the mind calm. ADHD people do not have very good sleep patterns or habits, so it is helpful to find little tips, tricks, and helpful habits to help you have not only a good night's sleep, but a restful night's sleep, and making sure your mind is calm is part of that. So I want you to just lay back, relax, and just close those eyes, and we're gonna just do some more tapping on you. So here we go. One, two, three, four, five. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. What are your fingers? 2, 4, 5. And we can just keep running the cycle until you fall asleep, unless you would like me to just gently work on your facial meridian points, which we can absolutely do. So let's just Just don't worry about a thing. Let your mind just drift, wander, and relax. There's no need to worry. Now we're just going to tune the top of your head a little bit because that can help really center you. So here we go. And we can also slow down the tempo a little bit, but not too much, because again, it's meant to keep us kind of stimulated a little bit, but not hyperstimulated. So we will just Alright, so one more time, we're going to do a little breathing. We're going to breathe in just slowly through the nose. And then out through the mouth. Good, and again in slowly through the nose. And out through the mouth. One more time, in through the nose. And out through the mouth. Good. Now I want you to just close those eyes, close those eyes, close those eyes. And we're just going to do a little more tapping. Alright, so here we go. And if you fall asleep, that's okay. Just remember, you can use this technique anytime, anywhere, any place. You can do it on your head. And if you don't want to physically tap, you can do it as a mental exercise. Alright, well, that concludes today's tapping therapy. And as I said, you can use that technique anytime, any place, for any problem that you have, or to help refocus your mind, or just help you relax before bed. But I see we have you on for another technique therapy session soon, so make sure that you check your calendar and set your notification for that, and we will see you again soon. Have a great night. Remember to hydrate and sleep well. Bye-bye. Hi there, I'm Dr. Tingle. So we have you back again today for another ADHD therapy session to learn about a grounding technique that can help you relax, center yourself, calm your nervous system, ease your racing thoughts, and even be a daily or nightly technique to help you relax and fall asleep. This technique is called the 5-4-3-2-1 grounding technique. That may sound familiar to you, as those are the 5 senses: your sight, taste, touch, sense of smell, and sound. While we do plenty of cranial nerve exams in this office, this is not quite a cranial nerve exam, though it engages all of those senses that we test. So the way the 5-4-3-2-1 grounding technique works is you have a problem, an anxiety, or maybe you just want to calm and center yourself. You take a few deep breaths in through your nose, out through your mouth, in through your nose, and then out through your mouth. Once you've calmed and relaxed yourself, you can do this mentally or physically. First, you start by identifying 5 things that you can see. You can think about this in your mind. You can look around the space that you're in and identify 5 things that you see. While you're identifying these objects, it's important to stay mindful and present of what you're doing. This is part of the exercise to help calm those racing thoughts. After you identify the 5 things that you can see, then you look and identify 4 things that you can touch. Those can be anything around you. If you were just laying in bed, it could be the sheet, the blanket, your pillow, the bed itself, your pajamas, or, as I said, you can just think about it. After that, it is 3 things that you can hear. This helps you focus on your surroundings and keep that mind at ease. Next, it's 2 things that you can smell. This one is usually better to just think about, as you don't want to be in an area where anything smells not great. That would not be helpful for this exercise. And then finally, the last one is identifying something you can taste. I like to tell my patients to identify something that's their favorite flavor or their favorite, food, whatever brings a smile to their face and joy to their heart. Alright, now that we have reviewed how the 5-4-3-2-1 exercise works, I would like to do it with you, okay? Alright, so we're going to start by taking in a few deep breaths. We're going to go in through the nose, and then out through the mouth, in through the nose, and out through the mouth, in through the nose, and out through the mouth, in through the nose, and out through the mouth. Good. Alright, so why don't we start with just taking something that maybe troubled us today. Alright, let's think about that for a sec. Let's try not to let it overwhelm our thoughts, because the whole point of this exercise is to calm those thoughts. And we're going to just use this exercise to take that troubled moment from today and just let it go. And just let it pass through our mind, so that it feels just like a fuzzy little dream that just goes away. Just a fuzzy dream that goes away, that you won't have to worry about anymore. So, take another deep breath in, and then out. Good, another deep breath in, and then out. Good, one more in, and then out. Good, and now let's identify 1, 2, 3, 4, 5 things that you can see. 1, 2, 3, 4, 5. Good. Alright, now we're going to identify 1, 2, 3, 4 things that you can touch. 1, 2, 3, 4 things that you can touch. Good. And now, 1, 2, 3. 3 things you can hear. 3 things you can hear. Maybe it's the plane flying overhead. Maybe it's the ocean. Maybe it's a gentle breeze through the trees. But it's 1, 2, 3 things you can hear. Good. And now it's 1, 2 things that you think of that you can smell. Or 2 things you can smell. 1, 2 things you can smell. 1, 2 things you can smell. Good. And finally, it's 1 thing you can taste. What's your favorite food? 1 thing you can taste. What's your favorite sweet? 1 thing you can taste that brings you happiness. Alright, now that we've run through that exercise again, we're going to do it 1 more time, and we're going to do it in a way that you can practice at home when you're trying to go to sleep, a way that's very relaxing. Alright, so what I like to do is tell my patients that when you're lying in bed at night and using this technique to go to sleep, it's best to keep your eyes closed, and visualize the 1, 2, 3, 4, 5 things. But I also encourage you to have the 1, 2, 3, 4 things that you can touch, preferably sensory friendly objects. But again, you can do this all in your mind. Think of it like counting sheep, a nice little checklist to focus on. And for those of us with ADHD, those clear and concise instructions are one of the little joys in our lives. So why don't we run through the practice again? And I have some things here that I will show you that can help you with a little more of the practical kinds of things you can do with this exercise. And one of those things that you can do, if you are familiar with fidget toys for ADHD, is actually use one of those as a grounding tool. So, for example, this is just a little stress ball that can be squeezed and has a nice, interesting texture. So, if I'm at home and I'm doing the 5 senses exercise, sometimes I will just use one object like this. So I will hold it up and I'll be like, okay, 5 things I can see. 1 of the balls, 2, 3, 4, 5. Cool. Now it's 5 things I can touch. The outside of the ball, 1. This ball over here, 2. This little one over here, 3. This one over here, 4. This one over here, 5. This one over here, 6. And I miscounted. See, I wasn't focused, and that's the point of this exercise, is it helps you to realize that you can catch yourself and that you have control over that ADHD brain. So we're going to restart that all from the top. So 5 things I can see. The outside of the ball. This ball here, 1. See, did it again. Look at that. It happens. I miscounted. But now we can refocus and do it again. So, one more time. 5 things I can see. The outside of the ball. 1. This ball. 2. This ball. 3. This ball. 4. The thick plug on the outer ball. 5. Now we got it going. Alright, 4 things we can touch. The thick outer plug. 1. The outer ball. 2. This ball here. 3. This ball here. 4. 4 things we can touch. Okay, so now we're going to do 3 things we can hear. So what's it sound like when we stretch the ball? Not too much, but we still heard a little. So 1. And how about if we just squeeze the ball? 2. And what if we do that to the ball? 3. 3 things we can hear. Alright, so now we're going to do 2 things we can smell. Well, it smells a little rubbery, but let's just smell the air. It smells like the lavender essential oil I have going on over in the corner. 2 things we can smell. Alright, let's do 1 thing we can taste. No, I'm kidding, I'm not gonna lick the ball, but I'll imagine what the ball would taste like. It would probably taste kind of plasticky. It may be a little metallic, but I'm not gonna lick it. But now we've completed the exercise. I'm in a good mood. I acknowledge that I messed it up twice, and that's okay because I completed it. And now, frankly, I'm just feeling pretty chill and relaxed. See how easy that is to do? It's great. So, why don't we try it one more time with you? And I will show you some other practical stuff. One thing I do like for this exercise is handballs. These are great for people with ADHD as a fidget or something just to keep the mind going. So you can use these for the 5, 4, 3, 2, 1 and just have these going in your hand as a additional way of keeping that mind focused, because this will keep the mind working to keep the balls moving in your hand, which means that you are actively engaged in making sure that you are keeping this pattern going. So if you want, you can try these out for yourself during this, or we can just continue on and go through the exercise again. Alright, so why don't we run through that exercise again, and we're going to use a few more tactile things for you to really ground yourself. So why don't we do a few deep breaths? Deep breath in through the nose, out through the mouth, in through the nose, out through the mouth, in through the nose, and out through the mouth, in through the nose, and out through the mouth. Good. Alright, and 1, 2, 3, 4, 5 things you can see. Back out. 1, 2, 3, 4, 5 things you can see, either in the room or if your eyes are closed. 5 things that you can imagine you can see. Good. And now we're going to do 4 things you can touch. So it could be like this Dratini plush here that is velvet and very, very soft. Very sensory friendly. Very, very sensory friendly. And will hang out with you on your shoulder like your little friend. So it's 1, 2, 3, 4 things you can touch. 4 things you can touch. 4 things you can touch. Like little Dratini here. You can touch the ears, you can touch the eye, you can touch the nose, you can touch the little horn, and you can touch the tail. 1, 2, 3, 4 things you can touch. Good, good, good. Alright, and now it's going to be 1, 2, 3. 3 things you can hear. 3 things you can hear. 3 things you can hear. 1, 2, 3. 3 things you can hear. 3 things you can hear. Good. Okay. And then it's going to be 1, 2. 2 things you can smell. 1, 2. 2 things you can smell. Good. And then it's 1 thing you can taste. 1 thing you can taste. 1 thing you can taste. Good. 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 All right. Well, now that you know the 5, 4, 3, 2, 1 technique to help you ground yourself, relax your mind, calm your senses, and also help you get off to sleep, I hope that you can use it to help you live a happier and more relaxed life, and also use it to your benefit whenever you need. And please, we are always happy to see you. So if you'd like to make another appointment, please schedule it at the front desk, and we'll see you soon. Take the rest of the day to relax, watch your favorite show, practice the 5, 4, 3, 2, 1 technique, and remember to get a great night's sleep. Bye-bye.